Welcome to this video on strengthening clinical judgment through the early recognition of neurological deterioration. This content is part of my professional practicum on the neurology unit at Seneca Polytechnic, supervised by Simone Wilson. My learning goal evolved during this placement. Originally, I focused on improving my assessment skills. However, based on my clinical supervisor's feedback, my revised goal is to focus on recognizing neurological deterioration through interpretation, rather than assessment alone. My SMART goal for this consolidation placement is to strengthen my clinical judgment by identifying subtle signs of neurological deterioration, integrating my findings with trends and diagnostic data, and communicating these changes effectively to improve patient safety. This goal is vital because neurological deterioration is often subtle. Early signs include increased drowsiness, pupillary changes, weakness, speech changes, or confusion. Detecting these early enables prompt intervention, which significantly improves patient outcomes. Neurological deterioration is a decline in function due to brain injury or impaired cerebral perfusion. Causes include strokes, brain tumors, edema, increased intracranial pressure, seizures, or metabolic disturbances. Identifying the underlying cause is key to timely intervention. To work toward this goal, I engaged in serial assessments, compared Glasgow Coma Scale scores, reviewed diagnostic imaging, and utilized SBAR communication. When evaluating a patient, I consistently ask myself 5 questions to guide my clinical reasoning. My thinking has shifted during this consolidation. Before, I focused on completing the assessment. Now, I focus on interpreting the findings, connecting symptoms to their underlying pathophysiology, such as understanding why increased intracranial pressure causes specific sign. Understanding increased intracranial pressure is essential. Brain injury leads to edema, which increases pressure and reduces perfusion, resulting in neuronal dysfunction and deterioration. Recognizing the progression from early to late signs is critical for nursing care. Recognizing early deterioration requires looking for specific findings. A decrease in GCS, increased drowsiness, pupillary changes, unilateral weakness, aphasia, or irregular respirations can all signal worsening cerebral function and warrant immediate clinical attention. In one patient example, I cared for an individual with a glioblastoma who became increasingly drowsy. Instead of only documenting the change, I compared assessment trends, reviewed imaging and labs, and consulted my preceptor before escalating concerns. Another case involved distinguishing between seizures and psychogenic non-epileptic seizures. This experience taught me that clinical judgment requires remaining open to alternative diagnoses and correlating assessment findings with results, rather than making premature assumptions. Clinical data must agree. For example, a rising blood pressure and falling heart rate can indicate a compensatory response. Correlating these clinical findings with laboratory values and imaging allows us to connect the dots and provide accurate, evidence-informed care. The biggest change in my practice was learning to interpret assessments rather than just performing them. I am now more intentional about integrating all patient data, which has strengthened my confidence as I transition into the registered nurse role. My take-home message is that clinical judgment begins the moment we notice a subtle change, not when the patient is already critically ill. By integrating information early, we can advocate for our patients and significantly improve safety. Thank you for watching this video. Here are the references used to guide this learning process.